Hello, Flint, Michigan. My name's Dr. John Powderly. I'm an oncologist here in Charlotte, North Carolina, and the founder of Carolina Bio-Oncology Institute, which is a phase 1 research clinic, and also the founder of Biocytics Human Applications Lab, which is a research lab and CLIA lab that's involved in immunotherapy and detection of cancer. And we've been doing this a good 20 years. And I had the pleasure of meeting Gary Puckrin about 4 years ago when he came to a cancer symposium in Charlotte and told a large audience about the mission of the National Minority Quality Forum and the Cancer Stage Shifting Initiative. And it resonated with me because I understand labs, I understand the value of early detection, and every day I see metastatic cancer patients who have run out of options and are searching clinical trials. And I know how a really good designed study could have a huge impact on populations who need it most. So I really, really wish I could be there and meet many of you and celebrate the opening of the trial in Flint, Michigan. But as you may have heard on TV, tomorrow, Saturday morning, we're expecting about 3 a.m. to have a bomb cyclone of a near blizzard conditions with 30-mile-per-hour winds and 5 to 7 inches of snow, and I'm pretty sure the airport will be closed tomorrow. And Cammie, I know you're there. I hope you can make it back late Saturday, but it might be Sunday or Monday at this point. So I wanted to talk to you about my role in the study and more about the study and the why. And I know Gary has probably explained all about the health disparities, and he's an expert in that, and I admire so much his passion and his drive to carry through the great need to open up these studies. My role is a little bit more on the technical back end of the regulatory and quality and making sure we're getting accurate data, that the database and the questions that we're going to be asking volunteers are important, and that we have measurable outcomes, and also that the samples we collect go to good use and they're ethically collected and they're going to have good high quality data when we analyze the study over the next 5 to 10 years. So I understand that Flint, Michigan, I think is the second or third site open, which is fantastic. And these sites that are opening are community-based, which is where the patients are. And in communities where there's going to be lots of outreach, going out to churches and community events and anywhere to get the word out for healthy volunteers who may be at risk of cancer or who don't know what the risk is, but they can learn about what are the cancer risks and what are the proven methods right now to detect cancer early with mammograms and prostate exams and colonoscopies, which work good, but not good enough of where we think we can get better with laboratory research in the future. So my job is to make sure that we follow the best practices to make sure all the samples and the trial is rolled out in a well-coordinated way that would pass FDA scrutiny should those samples actually develop a laboratory assay that prove that the studies work and therefore the device works, and therefore we now have something we can roll out and rely upon to inform patients that, yes, indeed, you have a clue or a signal that there is cancer. Now you need to go get more imaging or a biopsy or work it up more aggressively. So that's the background to the study. So I want to talk a little bit more about why the population of patients that we're approaching are going to be important. So to have a really good ethically designed study that is going to give us an accurate data set about determining answers as to whether or not we can detect cancer early, we have to have true negative patients, meaning volunteers who definitely don't have cancer. And then we have to have true positive patients, which we have a lot of those patients in our clinic, unfortunately, that are known to have metastatic cancer. In those two populations, we can get those samples relatively easy. But what is really valuable is the patients in the middle. And those are healthy patients who live in communities that may be at a higher risk, don't know the risk factors, may not get screening as frequently as they should, and therefore we want to capture those patients to offer them to enroll in a volunteer research study so we can help them get cancer screening, mammograms, colonoscopy, prostate exams, and make sure that they also have the opportunity and awareness of this trial so that if they choose, they can volunteer to give samples of their blood, which would go into a biobank, basically a liquid nitrogen tank where we can freeze it in a way that we can explore those samples with different types of laboratory technologies. And in modern laboratory medicine, we've come a long way over the past 20 years. We have the technology to detect cancer in very, very micro levels through many different types of assays. But the missing piece is doing a trial where we actually can see which of those modern technologies work the best for different types of cancers, what levels are needed. And then if a volunteer patient does turn out to have a trace positive, a signal that there might be cancer hiding, we want to be able to work that up and offer to help them get coordinated and navigated in to get additional imaging and workup. So that's the purpose of the study. So the main objectives is first to identify and reach out to collect the patients to get good, accurate health questionnaire histories and collect data about volunteer patients in Flint, Michigan. That's the first primary objective. Get lots of data. Understand the risk factors in your community. Second objective is offer to get the samples if patients are willing to donate. Even if they don't want to donate right away, that's okay. The study still allows them just to collect their health questionnaire data, and then they can change their mind and donate blood later. Is to collect a few tubes of blood that we can do good research on. Bank it for many lab partners who want to explore their highly sensitive assays, and then coordinate follow-up visits if some of those come up trace positive. So that's the second objective. The third objective of the study is to work with many different laboratory partners that make devices, assays, reagents, and technologies that they think in their labs, in their early studies, that they can detect cancer early. We call this multi-cancer early detection. So not just detecting one type of cancer like prostate with a PSA, but instead being able to test many different types of cancers, many of which we don't have good screening tests for at all. So this is a big promise and a big hope that might be possible, but we don't know for sure. So that is why the study that Gary and I designed is large enough with 100,000 patients at probably over 20 sites across the US in the underserved communities that need those types of research trials the most, so we can reach out and enroll those patients over the next 5 to 10 years. So, and we feel pretty confident with the many different laboratory partners and technologies that are out there that they will have good use and access to these precious samples that you would donate, so we can learn and figure that out and test that over time. It may mean that if you have a trace positive clue or signal that it might be cancer, you may have to come back or be invited back for additional visits. But that would be part of the study that would give us the answers that we need. Nobody in the study is going to be neglected. And everybody in the study has to understand that in an ethical research trial regulated by the federal government with all the ethical constraints, is that it's completely voluntary and the patients have the total right to withdraw at any time. This total withdrawal. We want patients to understand that it's completely voluntary and that therefore there's no pressure. You can think about it and you can decide later, come back in a couple months or 6 months or whenever. The study's going to be open in Flint, Michigan for many years. And if you do enroll, there's no issue for you to withdraw your consent. You might be wondering, how is your data going to be used? How is your samples going to be used? Great questions. Because the database that NMQF is setting up, it will be de-identified from patients' address and names and phone numbers, from any types of extraneous lab companies or research companies that might be looking at data, at trends, or even looking at the samples that come from volunteer patients. So that personal health information is separated from your medical history, and those are separated from the genomic samples, such that the blood samples, the genes, would not be directly linked to you as a person with you as an address. When you look at that data set from the health questionnaires, from getting access to your hospital records, if you provide permission to do that, to look at any diagnoses or other risk factors you might have, and linking that to the early detection tests in the labs we're working on, and with the genomic assays that our labs will be working on, that is one of the most powerful data sets that I truly believe has the potential in 5 to 10 years to really, really make an impact. And that's one of the measurable outcomes of this study is, can we actually detect cancer early? Can we do it better than mammograms and prostate exams and colonoscopies? Can we make an impact on your community there in Flint, Michigan? And I think with this trial and with this data set and all the ethical standards that we are going to enable and protect, the preciousness of the sample, the dignity of each patient, the right to decline or withdraw your consent, we think that we can still answer all those good questions. So what we ask of the volunteer patients is to give the trial a good chance to learn about it, so you can ask questions. And then if you are interested, the NMQF team and the Flint, Michigan community-based site will be reaching out to you to give you an informed consent, which is the ethical process for us to document so that you understand about the study, and we can then safeguard that understanding, that you understand the samples are being volunteered, we're doing research on your tubes of blood, it might lead to discoveries, and it might, in the long run, may benefit the community. And so that's the main take-home points I want to get across to the community as they listen to this. And I want to thank very much everybody who's coming out there. Some of our team members, Cammie's there, she's doing due diligence on quality and regulatory monitoring and inspections of the documents to make sure things are going from a regulated FDA standpoint. And I know Gary and his team are leading the charge to get the word out and to initiate the site, and they're going to take it to the next outreach into the community. So I look forward to being involved behind the scenes, and hopefully come to Flint, Michigan in another year and learn more about your community site. So thank you very, very much, and thanks for giving me this opportunity to help be an investigator in the trial in your community to detect cancer early. Thank you.